So in looking at our initial thoughts on a working hypothesis is first would be that Achilles pain with power and force deficits in the nature of Achilles tendinopathy. Second would be ankle pain with neuromotor control deficits of the lower leg, in the nature of more of an overpronation of the foot and poor absorption of forces through the foot, followed by ankle pain with mobility deficits where they have soft tissue restrictions of the gastrococcaleus complex. Irritability wise, we put kind of that insertional more at that moderate. It's that sharp pain with initial steps, increased pain after 5 minutes of running, and takes quite a bit longer to resolve with rest. P2 would be more along that mild, able to run for 30 minutes before the onset of symptoms, and able to reduce, so a little bit longer to come on and a little bit easier to reduce with some stretching. Subjective asterisks, big ones would be kind of those first steps with walking, as well as the onset of symptoms in that distance and time with running. So kind of right now it's at around that 5 minutes. Will kind of be something we'll monitor over time. How is load tolerance to running improving? And so based off of kind of the current elements of the exam, what elements would you look at in terms of cognitions, belief? Are there any functional questionnaires you'd have them fill out? What body regions would you want to assess, looking at lumbar or hip and knee? And then will you assess ankle range of motion both actively, passively, single plane versus combined plane, and would you apply overpressures? Does irritability allow for you to move into that vigor of your exam? So that's our standard elements. And then more specifically, what sort of things would you like to look at from a joint mobility assessment? How about soft tissue assessment, neurodynamics? Would you also look at mobility there? Finally then, what motor coordination or manual muscle testing and endurance would you want to look at? And then are there any special pain provocation tests to kind of rule in or rule out any of your competing hypotheses?